I'm Clint Hanley, and I've spent 11 years in Nicaragua, Central America, on the Atlantic coast. So I was looking for a place to go that I could make an impact with my family. My wife's a nurse, so I saw the needs that were down there. And so we went to the Atlantic coast of Nicaragua, and we spent 2 or 3 years there learning the language and clearing a runway. And then Wings of Hope came along and partnered with us, and we got an airplane down there, and I flew that for about 7 years. I've been asked before why we have been the only one that's based there for so long. 7, 8 years we've been flying there as the only airplane. I don't know the answer to that really. Partially it's because it's not a fun area to live. It's not a tourist area. People think of the Atlantic coast, you know, you're on the Caribbean. It's not a tourist area. It's off the beaten track. It's a low-level, swampy area, so there's a lot of diseases that they have that are mosquito-borne illnesses. And it's not a place that people really want to go live. What they can use is more infrastructure development in the healthcare area. What we offered is transportation to a better area where they're able to get that health care. The mosquito people of the Atlantic coast of Nicaragua, I feel that their future doesn't hold an awfully lot of change in it. They're subsistence farmers. They're hiking out to their village, from their village to their plantations, and they're bringing their food in. What they need is better access to medical care. We are not able to go down and change the structure of the whole way the health system runs. But we are able to offer transportation to those individual people who need the health care, to those people that it can save their lives, to the better hospitals where they can survive and their babies can survive. And in doing that, we're expanding into other runways. The pilot who's working down there now, TJ, is expanding into other areas where he is able to offer these services to areas that have never had it before. And in those villages, it makes a tremendous difference. The mortality rate goes down. We're also able to fly doctors and dentists into there and hold mobile clinics. So they're able to actually have preventative medicine at a far higher level than they've ever had access to before. In the 8 years that we were there in Central America, I flew over 500 patients, and a lot of those would have died had they not been transported. I went back and visited one of the first patients that I flew, and he had fallen on his machete, and it went inside his stomach. And so he was bleeding internally, and I flew him to the hospital, and it saved his life. And I went back and visited him about 6 or 7 years later. I visited with his little kids. He had had 4 kids since that time. And I saw his wife and the kids that he had previously before that. He had 8 children. And was able to stand on his porch and sit there and visit with him and realize that he wouldn't have been there. He wouldn't have had those kids, those children who were playing in the yard that ran up and hugged him. They wouldn't have been there had he not survived. The most rewarding part of working there is being able to walk down the street in our little village or in the town that was 6 or 7 hours drive away, and have people come up to you and say, you flew me a while ago and you saved my life, thank you. And in an everyday workplace where you work 8 to 5 for a corporation, you don't get that kind of fulfillment.